The measles virus was eliminated in Canada and the U.S. 12 years ago. Yet the Centers for Disease Control and Prevention reports that in 2014, the United States saw a record number of measles cases, 644 people. While Canada hasn't seen the same levels of the virus, there is currently a resurgence, with 4 cases identified in Ontario's capital city earlier this week. Dartmouth College professor Brendan Nyhan conducted a study to see why people aren't willing to change their mind about vaccinations that presumably would have prevented this outbreak. And joining us now for more from Hanover, New Hampshire via Skype, here's Brendan Nyhan. Brendan, it's good to see you. Let's just start with some background here. You recently conducted a couple of studies about vaccines. What were you looking to find out?
Well, we wanted to see what messages were most effective in promoting and vaccination and getting people to immunize their kids. And so what we did is we tested a number of public health messages that are used by public health agencies here in the U.S., principally the Centers for Disease Control.
So the idea is we'll test these messages, we'll see how much uptake there is, and what did you find?
Well, what we found was pretty discouraging. We tested a message that corrected the myth that vaccines cause autism, as well as 3 different messages that tried to communicate the dangers of communicable diseases that are prevented by the MMR vaccine. And we found none of them increased parents' intention to vaccinate a future child, which is the outcome we really care about most.
Do you know why it didn't work?
Well, in some cases, scaring people may be counterproductive. They may be more sensitive to thinking about risks from, for instance, to their child. They may be more worried about side effects in that condition. But what we think is most concerning is the effect of correcting that myth that vaccines give you autism. When we told people that vaccines don't cause autism and that the overwhelming scientific evidence rejects that claim, we actually found that the least pro-vaccine parents in the United States in our sample became less likely to vaccinate rather than more, which we think is a really troubling finding.
Can you explain why that would be?
Well, sure. We can't look into their minds to be sure, of course, but what we think is going on is that people are reacting in a defensive manner. We have lots of evidence that when you challenge people directly, they're very skeptical of information that they don't want to hear or that contradicts beliefs or attitudes they hold. These are parents who many of whom had mixed feelings about vaccines, some somewhat negative. And so when we told them that vaccines don't cause autism, what we think they did is bring to mind other concerns or questions they have about vaccines. In the process of thinking about those, they came to feel more negatively towards vaccinating than they would have if they hadn't received that information in the first place.
Well, let's look at some of the other things that you heard while you conducted this investigation. The autism myth we've heard numerous times. What else did you hear out there?
Well, in this case, we were doing an online study, so we didn't hear from people directly. What we tried to do instead was test these messages experimentally. One of the things that my co-authors and I have emphasized is the importance of validating the research we do and showing that the messages we use work. The vaccines that we use as drugs are very effective. The safety and efficacy has been tested in a rigorous scientific manner, but the messages we use to communicate about those vaccines is often done in a pretty ad hoc way. We wanted to see what effect these messages would have when we tested them experimentally. And so we not only looked at correcting this myth, but we tried to show people the different risks of the diseases that the measles, mumps, and rubella vaccine prevents. So we showed images of children who were ill with these diseases, which is something you've seen in the coverage of the most recent outbreak. People may have seen. We showed people textual information about the symptoms that can be caused by these diseases. And then finally, we showed a narrative, an anecdote about a single family, a single child who became very ill with measles. And that was intended to be more relatable to parents, but that didn't work either.
Brenda, maybe you could help me with one thing here that I've never figured out. Why is it that there are so many people in your country, and maybe some in mine as well, who are prepared to ignore the preponderance of evidence from the academic, medical, and scientific communities, and instead take the word of a celebrity who once posed as a centerfold for Playboy?
It's a good question. Jenny McCarthy is not the Surgeon General, but we certainly hear from her a lot in this debate. Part of the problem, frankly, is the media. She's great fodder for coverage. She's attractive, smart, and controversial, and that leads reporters to just keep writing stories about her over and over, even when the things she's saying have been debunked. It's important to say people claim not to listen to celebrities on health issues like this. I do worry about the influence that someone like her has, but at the same time, I don't think we should overestimate her influence. There are a number of ways people are getting bad information about vaccines, and I think she's a pretty minor part of that.
Okay. You studied also something called the backfire effect. What's the backfire effect?
Well, it's one thing that can happen when people are skeptical of information they don't want to hear. So remember, I was telling you about in our vaccine study, we found that people who had the least favorable attitudes towards vaccines became less likely to vaccinate when we debunked a myth about the dangers of vaccines. So it was a counterproductive effect. In previous research in politics, we found similar sorts of effects where people will double down on even the myth in question when you give them corrective information. It's really hard for people to change their minds, and especially when we feel strongly about something, when it's a partisan issue or an issue that's related to our identity, and that can lead to factual information having the opposite of the effect you might intend.
Now, if I understand this right, you did test for two different things, right? You tested for the flu and you tested for childhood vaccines, and I wonder if the reaction or the results that you got were different depending on which one you were referring to.
Surprisingly, no. Those are very different vaccines. So the MMR vaccine is part of the required childhood schedule of vaccines here in the United States. And of course, the flu vaccine is optional. And yet we saw a very similar pattern of responses in both cases. For the adults who were most concerned about the flu vaccine, they similarly became less likely to say they would get a flu vaccine when we debunked the myth that the flu vaccine gives you the flu, which we think is the most common myth about that immunization. So there's a similar kind of effect where challenging a misconception can actually have a response that decreases vaccination rather than increasing it.
Okay, so you have figured out how not to get the rates up. You've figured out what not to say to people in order to try to get them to embrace vaccinations. Can you give us a better understanding now of what does work in order to get people to embrace vaccinations more?
Well, so none of the messages we tested work, but we do have some recommendations based on the overall body of research. The first point is that we should work through healthcare providers. They're the most trusted source of information about vaccines. Parents name them overwhelmingly as their preferred choice. They already have relationships of trust with families and are meeting with those families on an ongoing basis as their children come to the doctor. So providers are the I think the first place to look. They can also be more targeted in identifying those parents who are most at risk of opting out and communicating with them. Lots of other parents are going to vaccinate. We don't need to waste time in those visits where they have a lot to cover. We can really focus on the people at the greatest risk. And the second point is to work through the community, to work through religious groups, community groups, business groups, educational institutions, people who already have relationships of trust with parents who might otherwise opt out. And I think those kinds of groups can be more effective than, say, government health agencies coming in from the outside.
You know, of course, that there are some religious groups and there are some ethnic communities that don't believe in any of this, and therefore I wonder how helpful they're going to be in trying to spread the message.
Well, you have to find the right intermediaries. It's definitely true that in certain communities that's going to be harder, but I think we can be effective. And actually, we've seen this in other countries too. The polio vaccine is very close to eliminating polio from the face of the earth, but it's still lingering in a few countries. And there's been great success recently, as I understand it, working with religious leaders in the Muslim community in Pakistan to help overcome barriers to immunization there. So there's precedents from all different parts of the world that these kinds of intermediaries can be effective. We just have to find them.
He may have both houses of Congress against him, but he still does have the bully pulpit. I want to play some tape of what the President of the United States had to say about this past weekend. Roll tape, please.
Measles is preventable, and I understand that there are families that in some cases are concerned about the effect of vaccinations. the science is, pretty indisputable. We've looked at this again and again. My children are vaccinated. You've got a new one at home. I'm assuming you're going to get them vaccinated. There is every reason to get vaccinated. There aren't reasons to not get vaccinated.
Are you telling parents you should get your kids vaccinated?
You should get your kids vaccinated.
How much help does that do for the case?
Well, unfortunately, it could be counterproductive. President Obama is a controversial figure here in the United States, as you well know, in Canada. Any president is polarizing, and we don't want vaccination to be a litmus test depending on how you feel about a particular political leader or head of state. It's no good for us if Democrats vaccinate and Republicans don't, or vice versa, and the same thing for your parties up there in Canada. Vaccination requires a social consensus across political lines, and it's important to keep politics out of that conversation. The problem we've had in the United States is that since President Obama made those comments, other politicians have been pulled into the fray, and we're getting more and more political style coverage of this debate, which gives people the wrong message. It gives people the cue that if you're on one side or the other, you should make a decision on that basis, and we don't want that to happen.
Well, in fact, Christie, the governor of New Jersey, weighed in after the president did, saying that while he's personally in favor of vaccinations, he also, and I want to get the quote right here, said parents need to have some measure of choice in things as well. Do you think parents ought to have some measure of choice when it comes to vaccinating their children against deadly diseases?
Well, it's a tough issue. Vaccines aren't a choice like seatbelts where you're only making a decision about your own safety. You're making a decision that affects the safety of other people, and that puts them into a very special category. I do think it's appropriate to have a limited set of exemptions from vaccination requirements, but we should think about how to appropriately strike the balance between personal autonomy and the public safety and community needs. Sometimes these exemption policies are very loose here in the United States. It's very easy to get them. In some cases, people have told me it's easier to get an immunization exemption than it is to document that your child is immunized. That's crazy. From a public health perspective, it should be precisely the opposite. A good example, I think, is the military draft. Right? The military draft is mandatory here in the United States, but there is a philosophical exemption process for people who have very strong philosophical objections. They can go through this route of trying to document that they are a conscientious objector to military service. That option is provided, but it's stringent, and it's appropriately stringent given the nature of the choice. I think the same applies here.
I just want to make sure I heard you correctly there, because I'm not sure the tense you used was right. Did you say there is a military draft in the States?
Well, there's not an ongoing military draft. We are subject to the draft. When I turned 18, I had to register with the Selective Service so that I could be subject to the draft. No, I'm not breaking news about it.
I was
draft starting in this country.
Just about to say, if they change policy on this, boy, I missed it, and I didn't think I'd miss something that big. Okay, good. Brendan, let me just make sure that I know where you're coming from on the issue of choice versus not. Are you content with the current process, which basically is you have choice on the flu shot, but you don't on MMR?
Yes, it's been very effective. That's how we eliminated measles in this country, is by having a policy that required children to get immunized before they entered school.
But you're not saying you want the flu to be mandatory as well, the flu vaccine?
I don't know of any way to make that realistic. Public schools are what make school regulations effective. But we can do a lot more on the flu vaccine, and I do think it's appropriate in certain settings to require flu immunization. For instance, healthcare workers who are not immunized can put patients at risk, elderly patients, people who are immunocompromised. It's very important in those settings that all healthcare workers be protected.
Okay, well, just in our last minute here, let me give you the opportunity to make the pitch. For those people watching us right now who are still skeptical after having heard this about the value of vaccines or whether they want to get them, you'd say what?
That's a tough one. There's no magic message that I can give you, but I just would say that vaccines are one of the great public health achievements of the 20th century, but we need everyone to continue to vaccinate to maintain those gains we've made. If you look back at the history of the United States and Canada, you can see incredible numbers of people who used to get sick from diseases that are now gone. A pediatrician here told me she tells her patients to go look at the ages of people in the graveyards around New England and see how different our lives are. Vaccines have helped make that possible, and we need to continue to do it.
Brendan Nyhan from Dartmouth College, it's good of you to join us on the line from New Hampshire. We're really grateful for your time tonight.
Thank you.
Support Ontario's public television. Donate at tvo.org.